good afternoon or good evening. We'll start today's webinar while also we will let people in, not to waste too much time from our speakers. So thank you so much for joining us today for our webinar, hashtag Prevention at Works, Turning Science into Action. Please interact in the chat, introduce yourself, share us where you're from, joining us from today, and also which organization you're representing. Today's session builds on the discussion we started during the previous webinar, Prevention Gone Wrong, What We've Learned the Hard Way, which was held on October 20th by UTRIP, while also finalizing our online campaign, hashtag Prevention at Works, that was held on all our social media accounts. And I will list the several important lessons that the webinar on October 20th highlighted, just to get an introduction and a summary of that webinar and what we actually will be building on today. So the last webinar showcased that prevention science is a 40-year-old field with a strong body of knowledge that can and should guide our work. Yet despite this, science is still too often overlooked in prevention practice. Prevention is not about how much we care. It is about how effective we are. Good intentions alone don't guarantee good outcomes, and evidence and measurable results are essential. Prevention must be long-term and consistent. Prevention means that addressing problems before they start, empowering communities to understand and solve the issues they face. Effective prevention goes beyond awareness raising. It does not rely solely on personal choice. It recognizes the deeper developmental, individual, and contextual factors that shape decision making. A person-centered approach requires investment, but it also offers a high return by strengthening protective factors that influence long-term health and well-being. A one-size-fits-all approaches don't work. Shared frameworks can help communities adapt and implement strategies that lead to real change, moving us away from one-off events towards lasting impact. Effective prevention requires ongoing monitoring and adaptation to the specific community context. Communities must drive the strategy. We cannot simply arrive as experts and prescribe solutions. Instead, communities should identify their own priorities and determine what is most important to them and choose approaches that are acceptable and sustainable in their local reality. Public health, education, child welfare, and criminal justice policies remain insufficiently informed by prevention science. And finally, and most crucially as well, we must remain open to course correcting as we learn. So today we continue this conversation. We are joined again by two speakers from the previous webinar and also additional speakers. Very honored with that too. And together we will explore what it means to make prevention actionable, consistent, and grounded in science. Our goal is to present practical models and tools you can take with you and apply in your own contexts. At the same time, we also want to continue highlighting the essential role of young people. Youth should not only be beneficiaries of prevention efforts, but active contributors, co-creators of programs, voices shaping decisions, and prevention influencers encouraging their peers. And so we are delighted to have two young participants, or even more, joining us today and also share their insights and activities. Throughout the webinar, we encourage you to engage and also keep on asking questions in the Q&A during the presentations, which we will then use in the final Q&A session. With that said, it's my honor to introduce our very first speaker, Vadim Alouf, presenting the actionable bundles of CHAMPS. He is the coordinator and team lead of the Global Program on Prevention and Prevention Treatment and Rehabilitation section of UNODC. And he has 20 years of experience in the field of social and health responses to drugs with UNODC. Vadi, the floor is yours.
Thank you very much, Cressida. And let me also extend another sincere appreciation for the World Federation Against Drugs through you for their efforts to consistently also echo the message of prevention and to implicate the civil society organization in these discussions in terms of latest update on prevention. And as you mentioned in your introduction, prevention that works. Launching my presentation in the meantime. And I hope the slides are showing up on your end. Does it show? Okay. So
I don't see them yet.
You don't see them. Okay. It is launched from my side. Should I try again?
Maybe, yeah.
Okay.
Now it seems to be loading.
Mhm.
Now we see it, not your presentation. We see something else. Yeah.
Yes, I do apologize. I don't know what happened, but I lost the presentation. But in the meantime, there you go. So I will take one angle of the presentation that I have started discussing in the previous seminar you alluded to. Can you see my slides now?
Yeah, your presenter's mode. So
Yeah,
maybe
I'll swap them.
swap the.
So I will talk a bit more details on the element related to amplifying prevention services through systems of prevention. Cressida, your introduction have introduced everything that required on the science of prevention. It was a very kind of a powerful presentation to set up the ground for this work, but an essential element that we're focusing on right now to amplify the power of prevention that you talked to that is based on science is to work in systems and come together as several partners around a common agenda and amplify the effect that is, and move away from silos and how do we come together in terms of improving the area of prevention. So the culture you have alluded to in the introduction, there's a science behind it. It's a developmental response. A developmental response can by no means be addressed by one entity alone. To accompany a person in different ages of development, let alone an entire population in different age of development, require a coordinated response by different silos. We know what works at every age of development and in the context where the person is during that age of development, depending in terms of level of vulnerability. A person-centered approach is key. It's not the drug that's the issue, it's the person, how we can help them, and how we can come as a multi-sectoral approach. That's the key message. So we know what are the evidence-based practices as elements of a system, but the supportive, the infrastructure around that system is an important component to make that system work. The legislations, the support from a financial perspective for sustainable effect, the qualifications and training of the prevention human resource infrastructures, the kind of having a common vision in terms of that investment, having investment that is evident, that is data driven, and also the responses that are supported by evidence in terms of effectiveness are key to have a better investment in an effective response. So and starting early in the ages of development is key. And that's why we focused on children, and we're talking less than 18. So what is unique of this initiative? It's an initiative that kind of mobilized member states to kind of do action in a different way than they're doing before. I mean, we're talking member state of the United Nations. They've taken a resolution this year based on that call for action of CHAMPS. That already is by itself a very important commitment, a commitment to kind of work multi-sectorally at systems. But what CHAMPS is providing is model places where these systems will be established by voluntary member states that are volunteering to join in and showcasing in a geographical area that they select within their countries that this investment can actually make a change in the life of children over a period of 5 years, meaning like assessing what the infrastructure they have as a system, aligning what they have as a system with the prevention standards, and filling in the gaps to ensure no child is left behind, and benefiting from that science and continuing monitoring the change of specific indicators of development that they have depending on the site to showcase that they have a better investment, a better return on investment that is not only related to preventing drug use, but other important indicators of childhood development because it's a person-centered approach. We're talking about prevention of crime, violence, school delinquency, mental health, and depending on the context that they have, certain countries are choosing because they have unemployability indicators that are essentials for them. Others that are potential recruitment by organized criminal groups, depending on the context that in terms of the vulnerability that the children in that context are exposed to. It provides also better science that's coming from the countries from an implementation perspective at the macro level. That's the core content that we want to work on. So you can see in different ages of development, there are different needs. Universal, which is in green, interventions that are in yellow, meaning these are selective for a subpopulation of children that are higher risks, and indicated, meaning and in red, for those that are symptomatic. I will not have time to go through this in details, but I really want to reflect this because we're working with a podium of civil society organization, and there are so many initiatives that are not necessarily drug specific, where the civil society organizations are implicated in providing child development activities that they can contribute to. And another element, there is the civil society can be a strong call for action for community mobilization in case there are any of these cells that are missing, to put that action in place and fill in these gaps to have that system. So we will review the prevention system that exists in terms of implementation, but I think these key ingredients as a kind of a mini map for the civil society organization by itself could be a call for action over and beyond the call for action to work as a system to move things forward. So essentially, this is an initiative that not only calls for a partnership between the public sector, the private sector, the academic sector, the civil society, and the interagency, even between the UN, to do work in partnership, but to demonstrate that by working in a partnership, you can actually make a difference, not only in terms of the developmental trajectory of the children by amplifying the prevention effect of each, but also by having a higher return on investment on the work that you're doing beyond the main domain that you're focused on. So this is a process that we are in its first year of implementation. So in terms of achievement, I don't have a lot to report back to you. But the main achievement is, aside this commitment of member states in a resolution of 2025 that they put, we have 11 countries that volunteered to be part of that system and to have model systems in place. Austria, Argentina, Algeria, Brazil, Cyprus, Ecuador, Egypt, Greece, Nigeria, Norway, and Uzbekistan. It's not the name of the countries that are important as much as also to focus on the geographical diversity that exists, the difference in problematics that different countries are facing in terms of child development. Prevention is a universal need. And this is an important context. It's not a problem of the low-income country, of the middle-income country, or the high-income countries. A child in development requires a system surrounding them for their development, and there are so many infrastructure that exist across all the countries that can be amplified in the investment being done moving forward. And besides the countries that are directly putting these pilots in place to showcase that they can make a difference in the life of children, we have other countries that are interested in the initiative in the general context and supporting it, like France, Italy, Malta, Slovenia, the United States. So basically, multilateralism in a nutshell, in a context of very high tension between member states, but showcasing that working with children, for children, and implicating, as you mentioned, Cressida, the youth and the children themselves, not only as recipients of the response, but as an active ingredient to make it happen, is what we're working forward. I really hope. I will not have time to discuss every single system put in place, but we have our first meeting in December 8th, so that these countries will discuss with each other where exactly they are putting these systems, in what context of children, and what they aim to kind of focus on in terms of indicators, so that there will be an exchange of expertise between them. And hopefully, we can make a reservation for next year. We will have specific outcomes to discuss with the general audience moving forward. This is a few examples where Brazil has set up a strategy to protect children from crime, violence, and drugs. And CHAMPS will be an articulation in 2 states that are there. The Ministry of Health and Population, really the Ministry of Social Solidarity in Egypt, has put alternative to slum areas as a priority to change the context of children that they move to these new settings and the relevant territory, as few examples, but other examples can be put in place. CHAMPS, you can Google CHAMPS and UNODC. There's a specific website that gives you more details, but I know time is limited and I don't want to take much more time than allotted for me. But this is just a beginning of the process that is crystallizing as we speak, that I appreciate, Cressida, to give us the time to kind of present to the audience. And maybe in the question and answer slot, I can provide more details as needed. And I pass the floor back to you.
Thank you so much, Wadi, for that very comprehensive overview of CHAMPS. I know it's a very big big initiative, and there's so much more to say, and it's very difficult to summarize it all. But thank you for so much, and yes, hopefully we can meet again next year and discuss some of these outcomes. It would be very interesting. So best of luck also next month with the meeting. So thank you so much. Our next speaker is Susan Mawa. She will be sharing programs implemented by NACADA and the importance of long-term monitoring. She is a counseling psychologist with over 20 years experience and a national focal point in Kenya as NACADA, in charge of drug demand reduction initiatives with a focus on prevention. Susan, thank you for joining. The floor is yours.
Thank you. Thank you, Cressida, for this opportunity again for us to also share from the public sector or from the government perspective, because that is where I work. And it means it is what is happening on the ground. So from the Kenyan perspective, we've actually done research. And yes, after the research, then what next? So that is what I'm going to share about. And one of the challenges that probably anyone who has attempted to have something new coming onto the ground or improving what already exists, then knows that this is one question that we would ask, because we know prevention science, we know what works, but then how do we translate this so that it is able to help us? So generally, there are good efforts as provided even by Dr. Wadi on the international standards. Communities also want the best interventions that work, but there is always the aspect of compatibility, particularly when we look at it in the developing world like Kenya. You will find, because one, there is resource constraints. So there is always this foreign tag, and therefore the need to actually convince policy and decision makers that this is actually the best science. So I'm going to present one of the ways that we have attempted to actually convince the decision makers that when we implement something that is informed by science, it is actually the best thing that we can do. And like I've mentioned, as NACADA, we do 5-year surveys, national surveys. We've done for secondary, we've done for primary, and therefore this gives us the foundation that helps us. The next conversation we are holding is, can we have a follow-up survey? Because you will always need to make a case for prevention. And one of the critical things that came out, because now we have, what I'm going to present is the policy approach that we have taken with this, because from the surveys, we know this is the level of prevalence, and particularly when you look at the environment, what is it that is happening within the environment? Where are drugs found? Who is bringing it, and what else can be done? So that is basically what I'm going to present on. And if you look again from the international standards, some of the recommendations are policies to keep children in school, to improve on even the school policies, so that we move from the non-punitive to the non-punitive approach, rather than the existing approach where drugs are not found in school. If you are found, then you will be excluded from school. That then negates keeping children in school. And also the aspect of prevention education, which should be based on the personal and social skills and also the social influence. And we are also cognizant that there are those who are already experiencing problems. So how do you address these individual psychological vulnerabilities? And therefore, I'm going to talk about one policy document we have developed, which is the National Guidelines for Alcohol and Substance Use Prevention and Management in Basic Education Institutions. So you'll find that part of the objectives, they would like to eradicate. If you work in government, if you say we want to reduce, then they say, no, it is eradication. So Don't ask, why are we saying we want to eradicate when we know that that is not sometimes not possible. But in the school premises, the school functions and also activities, establishing mechanisms so that we support preventive education for the school community, not just the learners, and also respond appropriately to the challenges that learners are experiencing. So these are the core components of this approach, so that the preventive education is not just targeting the learners, but the parents and the teaching and non-teaching staff. Because from the surveys, it turns out that even the teaching and non-teaching staff will be suppliers of those drugs. So if you leave them out, then it doesn't help you much. Now, there is the aspect of supply reduction, which, because we are looking at the school environment, then it means we target the board of management, the school administrators, and even the teachers. Then there is the aspect of, for those who already experience problems, the counseling and treatment support. And you can see that targets the guidance and counseling teachers and the school administrators. Now, one major challenge was incident management. How do they handle incidences that they come across in school, and therefore it targets the board of management, the school administrators, and the teachers. So then you can see that there is a lot more in each of these components that it's also available on our website, and therefore if there was much more time, then we would talk about that. And even what we have done in terms of just reports on how far we have done. So it means that we are actually targeting each of these components. The people who are involved in each of these components, we are actually targeting them. And so maybe at another time, we'll be able to share what the findings are. But what are some of the challenges? Because we are talking of something which is long-term. And in this document, we've also provided a monitoring tool. And for those of you who ever work with prevention people on the ground, you will know that monitoring is the biggest challenge. So that means there is the need to build capacity for monitoring implementation so that people embrace documentation. Then there is the resistance to shift from just awareness creation to programs that target specific populations. So that I'm talking about teachers, and I'm talking about boards of management, I'm talking about the learners themselves, so that it's not just the learners. And the biggest challenge also is usually resources, because there is always that pressure to produce immediate results. So what do we see now? So if you talk about 3 years from now, then you will find that the others who can talk about what can be seen with the eyes right now are likely to be heard more than the ones who are doing prevention. So for those of us on the call who are in this space where you need to make a case for prevention and particularly allocation for resources, what are some of the things that we need to do? We need to have research. We need to have research. Our research, particularly for primary and secondary, may now be getting old, but at least we have a starting point, because we can always refer back so that we can make a case for prevention, and the need to build capacity for policymakers. And this is not something that takes a short time. Yeah, it is, you keep on doing this because the buy-in is very, very important. And therefore, there's also capacity building, because that's the other thing that we are doing, building capacity for in-country prevention professionals so that we can raise a critical mass, and those can be who can reach the various corners of the world, because we are of the country, because we are talking about many basic education institutions, and the most important is leveraging on partners for scale up. So this in as much as I have singled out some of the people who are targeted, the public sector, the private sector, the civil society organizations, faith-based organizations, because we are very strong also on faith-based. All these are part of the people who must speak the same voice so that we can make a difference in our part of the world. Thank you very much. Over to you.
Thank you so much for sharing your incredible insights and also the research outcomes that you have done. And NACADA has been always very good in creating such surveys and creating such a great evidence that can be used also even by civil society. The results that are established by NACADA can also be used by civil society to build further onto it. And also, I know you collaborate a lot also with civil society in Kenya to kind of get that implementation strengthened. So thank you so much for that. And yes, next time I'll give you more time to go more into the details as well. And I think one thing you said really well is in the end, of course, is the monitoring is very important, although it's very difficult in prevention to do that short term, but it's something that should not be forgotten. Like we need to continue doing that and integrating that in our work. So thank you for joining us today. Our next speaker is Mate Kosir, and he's joining us and will share about his book, Prevention Gone Wrong, and also highlight important takeaways and examples of evidence-based prevention activities. He is the Director of Institute for Research and Development, UTRIP, from Slovenia, and the chair of the Vienna NGOC, and he's been working in prevention and advocacy in the field of substance use and other risk behaviors and addictions for about 25 years. Mate, thank you for joining in. The floor is yours.
Thank you for your invitation. I hope there are mostly new people at this webinar, not the same as in the previous one mentioned, because I will repeat some things from my presentation from the first webinar. So yeah, as you mentioned, it took me quite a while to write and to finish my book. It was published in March this year, but it took me 10 years to complete it. So it was a long process and almost 30 years of my frustrations in the field of prevention. Because at the beginning of my career, I thought, that was my perspective at that time, that if you bring evidence to the table, then decision makers and policymakers will be happy and they will start implement those practices or policies. But it doesn't work like this. So after a very short period of time in my career, I realized that there is something more we should do in the field of prevention to get to the point we want to be in prevention. And the most time I spent in the book is to write it in a user-friendly language, so everybody can understand what is written in the book, because there are a lot of prevention science and practice books, but a lot of them are very theoretical, scientific, and people working in the field, in grassroots organizations, or school teachers, or social workers, or NGOs, they barely understand what is written in the books. We have really, I would say, not so recent, but still experience with international prevention standards. It's also very friendly written publication. Most of us professionals, we all understand what is written in it's actually our Bible, so we should understand it. But when you ask people, usual prevention practitioners, they barely open the book and the publication and read the text. We also translated these standards into Slovenian, but we still struggle. I always ask at different events and conferences, how many of you open the publication or read the publication, and the number of hands are, I would say, disappointing still. After so many years of existence of these standards. So, but as I mentioned, I wrote this book in a user-friendly language, so I would say that everybody could understand it, even parent, even the teacher, or whoever wants to do something in prevention could understand pretty much all the content from the book. So there should be no more excuses after reading my book and saying we didn't know something doesn't work or what works. So, but most of our interventions in the field of prevention are based on a kind of common sense. So we think that if we bring somebody with experience with drugs or celebrity talking to kids about, to be sober and it's not good to use drugs or losers use drugs and so on. And then we see the other reality of those people. I just put this Marilyn Manson here as a example. Maybe it's not a good example, but there is one citation from Marilyn Manson in the book as well. And he once said that I say no to drugs, but they don't listen. So it's kind of funny for him. And in many cases, we think about it that bringing celebrity, bringing some guy with lived or living experience to the school and explaining kids what drugs can do to them, it's not really a good idea. Although it's based on a kind of common sense. So we think that might change the perspective and direction of kids and young people's behavior. Mostly, I would say 90% or 95% of people working in the field of prevention are good intended people. They want to do good things, but sometimes not with very good strategies. As I said, most people in prevention mean well, but good intentions alone are not usually not evidence-based, not effective, and particularly not enough. So there should be something more in prevention if we want to change behavior or attitudes of beliefs of people, etc. There are some, I don't want to go into the details and explain in details what often goes wrong in prevention. Those four are the most common wrongdoings in prevention, especially fear-based campaigns, just say no slogans, usually one-off interventions or lectures, bringing celebrities or people with lived or living experience with drugs, and a lot of interventions which are very short-term. Or is it 1 hour, 2 hours, lecture or workshop? This is usually not enough. It doesn't change anything. Maybe it stays in people's heads for an hour or maybe half of the day, but next day people go back to their own realities and they simply forget about all the messages in the lectures or workshops. It's the better alternative if we want to change some things. We need to start thinking in a long-term and consistent way of doing prevention and evidence-based offshore. I mentioned already international standards. Those standards are Bible for prevention science and practice. So everybody who is serious in the field of prevention should read and study those international standards because it is a very good starting point to avoid any kind of misunderstanding or any kind of wrongdoings in prevention, and also should be developmentally appropriate and also community and family connected, because sometimes we push so much school-based prevention. We are everywhere in schools. We try to teach and educate all kids, but we usually forget about the whole community context and also the family context. So if we want to multiply our efforts and outcomes, we should involve families and also communities as a whole and create some community prevention teams or mobilize communities in a sense of evidence-based prevention, not just practice, but also policies. And of course, it costs us a lot if we don't do right things in prevention. It's wasted resources. It's also disillusionment. We think we are doing right things, but actually we are not doing anything, or we are even harming our target populations. And kids and young people are left unsupported, but not just young people and kids, also the whole families and communities are left unsupported. And some evidence-based initiatives, interventions are based on like life and social skills programs, family-based programs, well-structured school programs. But in the case of school programs, I want to also mention that it's not necessary to push with structured and manualized programs. Sometimes the preconditions for evidence-based school-based prevention is to create a positive school climate, to work on effective school policy and connectedness with external stakeholders like parents, community, and so on. Those things are sometimes even more important than the programs, interventions in the schools themselves, and are surely precondition for any kind of evidence-based program in the school. Because if we bring like Lion's Quest or Unplugged or whatever we are speaking about related to prevention program to chaotic school, with I don't know, with problems in communication and relationships and so on, it's usually a waste of energy and money as well. And also community initiatives are very effective, and particularly environmental strategies. It means also if we want to be successful in prevention, there should be a strong backup also in policy, like alcohol policy, tobacco policy, and also illicit drug policy, or most recently very popular cannabis policy. Those are 5 pillars of effective prevention, as I mentioned already: life and social skills, strong family and school bonds, youth engagement as well, very important, and long-term structure strategies and evidence-based policies, as I mentioned as well. So what have been the lessons learned in the last my 25 almost 30 years of my career? And I would like to transpass these messages also to all of you. So please let us stop repeating what doesn't work. We know now what doesn't work, and we also know what harms. So we should stop doing this as a first step, and then start thinking about alternatives. We should not use fear or slogans because they don't change behavior. Don't use celebrities because they can backfire you. In Slovenia, we have a good example of, using the most popular rock band as a prevention advocates, and then a year or 2 years after, they sign a contract with the biggest brewery, and they started to become I would say a symbol of beer industry. So it could backfire very simply if we use this kind of people. And quick fixes, they are never a good option. And we should all learn from our mistakes. We did a lot of mistakes in the past, and we should not repeating them over and over again. So this is actually a call for action. We should go from good intentions to evidence, and keep passion and action as well, but just add evidence and ask ourselves, what are we going to do differently in our prevention work tomorrow, or maybe already today? And this is the book I was talking about, and Cressida mentioned as well. So if you want to learn a little bit more about the content of the book, about harmful and ineffective practices, and also alternatives mentioned in the book, you're free to scan this QR code and purchase book. It is available on Amazon, but you can also approach me, and we will try to give you the opportunity to read the book. And this is my final message before I finish. It's not about being perfect in prevention. It's just about effort and being better every day. So if we can improve something already this afternoon or tomorrow morning, we are on a good way to become, I would say, effective and evidence-based prevention intervention provider. So, and always don't forget, we should always combine honesty, humor as well, and science, because this is sometimes the best way to get to direction we want. So thank you very much, and I'm available for any questions and comments. Thank you.
Thank you so much, Mate, for highlighting the book, but also highlighting the lessons that you have learned in your long career, and that you have put that in a very easy, accessible, and understandable book, and clearly have also shared some of the methods that work and that don't work from your book. But I know you have mentioned more in your book as well, so I can only recommend everyone attending today to read your book and learn from that. It's as you said, it's good to keep some humor in it and not to lose the passion, because sometimes it might feel that, oh, I'm doing everything wrong, maybe I should not do it at all. But that's not the message that we're trying to set here. It's about improving ourselves as we go. So thank you for putting that out there. So with that, we're moving from our so-called experts to our youth experts, I would say, a second part of the webinar, but definitely not disconnected. It's very interconnected. But before I move on, I want to encourage everyone, if you have any questions, please write them in the Q&A. So we have an overview of what questions are out there. We will have enough time by the end of it. So with that said, I would like to present our first youth representative, Aliou Mukhtar Usman. He is a youth leader and certified prevention practitioner dedicated to building drug-free communities through evidence-based strategies, policy advocacy, and youth empowerment. And he currently serves as a youth leader of the African Union Youth Forum on Drugs, where he co-drafted the first African Youth Declaration on Drug Use Prevention and represents African youth voices on global platforms. Thank you so much, Aliou, for joining us today.
Cressida, thank you. I'd like to share my screen now.
Yes, we see your screen.
All right, so you can see my screen?
Correct.
All right, good morning, good afternoon, and good evening, depending on where you're joining us. It is indeed a true pleasure and privilege for me to join this esteemed panel and this discussion. And I thank World Federation Against Drugs and you, Cressida, personally for the invite. I am particularly excited because this conversation sits at the intersection of two things that I deeply care about. One is youth-led community intervention and, of course, evidence-based prevention. So that is why I made a little bit modification to the topic, prevention that works, turning science into action, the role of young people in evidence-based prevention. So I will actually skip the introduction part because Cressida did that. So this is an information note that this presentation will practically highlight some of the practical experiences. So this presentation will showcase some practical experiences or ways young people can contribute to evidence-based prevention, thereby turning evidence into action. So building on what the previous experts, my mentors, have already said, we know from research that prevention programs are mostly effective when they are based on evidence, when they produce results. These evidences, when we're sure that these evidences produce results, and when we're sure that they are data-driven, they are culturally relevant, and most importantly, they involve or include the voices of those they aim to serve, particularly in this context, the young people, since we know that the young people carry the majority share of our population. Now, I believe the first step in making sure that the prevention work that we do actually works is by engaging young people in the prevention, because young people are the key agents of social change, and they bring a lot of energy, the youthful exuberance, the optimism. They bring creativity because there are new trends and there are new things that are happening in the drug use, and there are new trends. So they bring lived experience because some of them have already been involved, and most importantly, there is an influence of their peers. So this is where youth leadership and engaging youth in prevention actually becomes necessary and very transformative. When young people are involved in designing and implementing, as well as evaluating prevention strategies, the programs have higher chances of resonating with the audience, which happens, of course, in majority of the cases to be young people. They have higher chances of being accepted, and they also have higher chances of producing lasting results, thereby becoming what we call prevention that works. Let me put it on the record that I am not in any way insinuating that the prevention work should be for young people alone. It is not a takeover, it's not a hostile takeover situation. Rather, what I'm saying in essence, that the prevention works need the wisdom, the experience, and the maturity of the old, as well as the enthusiasm, the radicalism, and youthful exuberance of young people. A practical example of how we can engage youth in prevention or a practical example of how that is possible is a simple example of a program I launched called the Peer Support and Recovery Program in Nigeria in 2022. The program is a youth-led drug use prevention intervention funded by the U.S. Department of State in 2022, particularly to address the alarming rate of increased substance use among students across Nigerian universities. The pilot program started in Ahmadu Bello University, and we later expanded to 4 other universities in the country. Although this is a one-time funding, but we were able to sustain it through partnership. So we were able to achieve quite a lot of success. This include, training of 365 young prevention influencers. So since 2022, we have organized step-down training sessions for prevention influencers in every semester in the university. So these images highlights example of some of these sessions we've conducted in 2023, and this is in 2024. And we have also facilitated the registration of 36 young people to obtain the Universal Prevention Curriculum Certification with support of ISOB Nigeria and GISA. We also organize sensitization and public awareness. Very luckily, we were opportune to have one stakeholder engagement summit in the university in 2023. That we also have a system where we link students that into substance use to counseling, because in the university we are connected with the counseling directorates. Professional engagement is another way we make sure that young people are becoming more and more interested in prevention work. So when they have access to national and global experts in the field of substance use prevention, it strengthens their resolve. And we do that by making sure that we arrange attendance of conferences such as that of ISOB in Nigeria. Now, prevention that works is not actually about number or matrix. It is about listening. It is about learning, and also it is about adapting intervention based on what truly works. So in Nigeria, for example, community and religious leaders play a very vital role in the entire social fabric. What people accept or reject has so much to do with their religious and cultural norms. Therefore, prevention strategies must recognize each community has its unique challenges, it has its norms. So for prevention to work effectively, these factors must be strategically put in place. Now, youth engagement is not a nice to have. It is a must to have. involving young people from the point of learning ensures that prevention programs are relatable and they are also relevant. So when your young people lead, they automatically inspire their peers. They also advocate for policies. They also foster environment where prevention messages are very loud enough, be it online or offline. So as we think about turning science into action, we must therefore recognize that prevention is multidimensional. It involves education through building capacities. It also involves advocating for policy. It also involves providing mental health support and partnership with communities. Now, these are some actionable takeaways that we need to center our prevention to community. We need to engage local stakeholders, including young people, including women, educators, and leaders. They can actually help us in both designing and implementing interventions. Now, the evidence is key. We all know that we cannot do anything without evidence. So we must monitor, we must evaluate. I'm happy that Dr. Susan has talked about monitoring and evaluation in order to continuously ensure that the programs and the project that we do work in real life, and so that to achieve the desired results. Very importantly, we need to empower young people as agents of change in our communities. They are not mere beneficiaries, so we should see them as leaders. We should see them as advocates and innovators who can actually turn theory into action. In conclusion, prevention is about building resilient communities, thereby fostering equity and enabling individuals to thrive. So when we combine scientific evidences and youth-driven solutions, and also community priorities, we can ensure that the efforts are more effective and they're more sustainable and they can actually work. I am so thrilled to be part of this amazing conversation today, and I look forward to sharing insight and learning from experts. I thank you for listening. Thank you, Cressida, and over.
Thank you so much, Aliu, for your wonderful presentation and highlighting, like you said, engagement of youth or integration of youth is not a nice to have, but it's actually a must to have. And also by showcasing some of the programs you have done successfully by training so many youth. And like you said, the peer influence is strong, but peer influence can be positive. And that is something that youth can be very much engaged in. So thank you so much for that. And also that is not just that what you said was nice, like as older people and the collaboration with the younger people, that remains a very important aspect. So thank you so much for that. Now I would like to introduce us to our final but not least speaker, Aparna Vinod. She's the core team member of So Why I Engage from Fourth Way Foundation and currently pursuing an a graduate degree in English literature. And when talking about peer influence, I think you're one of the great examples. So the floor is yours.
Thank you so much, Cressida, for the introduction. Good evening from India. I am Aparna, a working group member of SOWI, short for So Why I Engage, of the Fourth Way Foundation. I am honored to represent SOWI, and I thank the World Federation Against Drugs for this opportunity to showcase the impact we've made. I also thank Diana Vincent, the director of Fourth Way Foundation, whose support signifies shared dedication to ensuring that young people are truly heard in every conversation that affects them. So I'll be presenting about SOWI, what SOWI is, and our key activities and engagements in the past years. So talking about SOWI, short for So Why I Engage, is the youth engagement platform of Fourth Way Foundation that connects young people from all over the country to empower and engage with multiple social development outlooks through conversations, ideation, and discussions. We foresee this as an open space to explore opportunities for working together on matters that shape our world. As the International Youth Foundation quotes, the young people are not problems to be solved, but problem solvers themselves. Led by teens and young adults, So I actively advocate for youth representation in matters concerning them. We strive to ask questions about society and social issues and why we should engage with the world around us. Through this platform, we wish to motivate our contemporaries to come together and be involved in matters that will influence others to understand the problems we face around the world, some of which exist even without our knowledge. Article 3 of the Convention on the Rights of the Child talks about the best interests of the child. When adults make decisions, they should think about how the decisions will affect children. Adults must always consider what is in the best interest of the child. Government should make sure children are protected and looked after by their parents or by responsible adults when this is needed. Since we are the future of the world, youngsters like us should have an equal say in decisions and matters that affect us. Article 12 of the UNCRC gives us, that is, children, the right to participate. Children have the right to express their views freely in all matters affecting them. The views of the child should be given due weight. We have a right to participate in matters that concerns our future. So I aims to bring like-minded youngsters together where they can discuss and ideate about the possibilities of finding solutions to the various problems existing around us. Article 33 of the UNCRC talks about how children should be protected from harmful drugs. In this day and age, we are exposed to a lot of harmful substances, and governments have a duty to protect children from consuming, making, carrying, or selling harmful drugs to protect all children around the world. Now, why only in India? The 52% of the population in India consists of us youth. This has significantly affected youth engagement in various aspects of society, including civic participation and social activity. A higher percentage of youth in India has led to increased youth engagement in various spheres. It requires the support of institutions, policies, and communities to channel this engagement effectively for positive societal change. The youth can be a driving force for education and skill development. Investing in education and training for the youth can lead to a more skilled and knowledgeable workforce, which is crucial for economic development. A large youth population can also present challenges, such as ensuring access to education, healthcare, and employment opportunities. If these needs are not met, it can lead to issues like youth unemployment and social unrest. In India's case, the management and harnessing of its youth population are critical for the country's future. Proper investment in education, healthcare, and job creation are essential to realizing the potential benefits of a youthful demographic structure while addressing the associated challenges. So the SOY comprises of three major groups. That is our structure. SOY working group, the engagers, and the animators. The working group are like the core team that plans and facilitates various programs at SOY. The team will be directly groomed by social development experts and trained by the Fourth Way Foundation. During their tenure, the working group will also have avenues for engaging with other civil societies and non-governmental organizations worldwide. Now, the second group engagers are those individuals who participate actively in all thematic webinars and contribute to building the SOY program. Engagers will support the working group in organizing various programs and events. An engager will also pave the way for becoming a part of the SOY working group. Now, finally, the animators. They are primarily the other youths who guide the working group. Now, talking about the core engagement of SOY, the core emphasis SOY gives is on prevention. In India, only 5% of the population need immediate aid. The majority of the youth are non-users who must be protected and prevented from future use. The prevalence of substance abuse among the youth is rapidly increasing and is to be seen as a force threatening the welfare of this largely demography of nations. Prevention is always better than cure, and to keep the large majority of the non-users safe from the future exposure to substances of abuse, the young themselves need to step in and come up with innovative and practical ideas that can keep them safe and protected. In this context, there are certain key activities that SOI has done. For example, webinars. The working group effectively organized 7 webinars, and the webinars have hosted speakers like George Odello, the executive director and founder of Slum Child Foundations based in Nairobi, Kenya, Regina Matson, Secretary General of the World Federations Against Drugs, Billy Batwari, Program Officer, Crime Prevention and Drug Policy, UNODC, and the founder of International Security and Conflict Analysis Network, Carlton Hall, CEO of Carlton Hall Consulting LLC, Cedric Hall, Director of Equity and Climate for the News of City, Department of Education, Chantal Pepper, Department of Social Development, South Africa, Shelton Pinheiro, Executive Creative Director, STAR Communications, India, and other notable dignitaries. These webinars are held to spread awareness and engagement on topics such as child abuse and victimization, children in slums, children and drugs, youth engagement, youth in media, etc. Most webinars focus on the youth perspective, as SOI's primary goal is to create a youth network that addresses relevant challenges young people can actively engage in. For one of the webinars on youth engagement, the working group members served as a resource team inspiring the fellow engagers. Recently, we commemorated World Alcohol Free Day with an interactive session having Christina Spakova, International President of Muvendi International. The session focused on raising awareness and meaningful conversations on alcohol-free fun. Secondly, the social media. The team is proactive in planning and creating engaging social media content catering to the youth, especially on days commemorating international observances, ensuring that the platform's social media presence remains active and relevant, amplifying important causes and reaching a broader audience. Participations at the Youth Forum. In November 2022, SOVI members attended the Youth Forum organized by the Footway Foundation and Colombo Planned Drug Advisory Program and supported by the Bureau of International Narcotics and Law Enforcement Affairs, U.S. Department of State. The Youth Forum was part of the Children Matter Forum, an international event organized by the Footway Foundation with World Federation Against Drugs and the United Nations Office on Drugs and Crimes in Kerala, India. The working group also participated in the 11th Asian Youth Forum on Drug Use Prevention organized by the Footway Foundation and Colombo Planned Drug Advisory Program and supported by the Bureau of International Narcotics and Law Enforcement Affairs, U.S. Department of State in September 2024 in Kerala, India. The forum focused on creating youth prevention influencers and was attended by 150 youth from 13 countries. The working group members and the animators significantly contributed to the youth declaration at the two forums drafted by the youth group at the forum. As an outcome of the Asian Youth Forum, the prevention model that we developed will be implemented in the colleges also with the support of the SOVI team. Presentations at the Youth Forum follow-up meetings. In 2024, at the virtual follow-up meeting with participants from different youth forums all over the world, conducted by the U.S. Department of State Bureau of International Narcotics and Law Enforcement, Colombo Plan and CICAD, in partnership with Drug Free America Foundation, Footway Foundation, and the World Federation Against Drugs, SOVI working group members presented the SOVI journey and the measures implemented by the 2022 Youth Forum participants in their schools and colleges to address the challenges of substance abuse using the knowledge and skills gained from the 2022 Youth Forum. SOVI at the United Nations, Vienna. Footway Foundation is one of the early advocates of youth representation and youth voices at international platforms, including the United Nations. SOVI working group members and animators have been consistently attending and speaking at various side events at the United Nations Commission on Narcotics Drugs since 2023. The team has represented Footway Foundation and spoke at a technical consultation meeting on social media and drug use prevention in August 2025 at the UNODC headquarters, Vienna. To conclude, So Why I Engage is a testament to the power of youth. When young people come together, take ownership of their communities, and are given opportunities for meaningful engagement, they become unstoppable. They become influencers, prevention, and catalysts of change. Thank you.
Thank you so much for your presentation and also for your very strong statement. I was just typing it down. You become indeed unstoppable. I guess that's something that we will work with. I mean, that's why youth is so important to be engaged. And what was said earlier, it's the dynamics that changes prevention. And I think the energy that youth have and also the importance that youth carry and the experience that you carry is so incredibly important. And thank you so much for sharing all of the incredible work SOI has been doing over the years and continues to do, to represent that voice and to create that positive peer influence. So with that, we are now reached our Q&A session. So if you have any questions, please do share it in the Q&A. We have a bit more time left, and I think I will just start with the first discussion question for all speakers and panelists that are here with us today. So since we are now in the discussion of involvement of youth, I think the question I would like to ask all of us is, first, how can we move from talking to youth to talking with youth, and also then to the youth directly who are here? What do the youth need to feel like equal partners in prevention initiatives? So I don't know who would like to start answering this particular question. Otherwise, I'll just start putting people on the spot.
I can give it a shot.
Go ahead, please.
That will give me a youth voice. A bit too late, but I'll have a youth voice. So basically for us, this generation of youth is not the usual generation of youth that we face. And this generation of youth is very socially networked and active. So they can have a policy voice. What they need is actually the tools to have their voice kind of be backed up with science. From our side, we have availed discussion guides for the youth that are available on our website for them to self-read and self-guide themselves to know. We strongly advise the youth to actually use these tools. Another opportunity we're providing to youth, even though it's on a limited scope, is to come to actually talk to the policymakers in the Commission on Narcotic Drugs when they're making these resolutions. This is one podium that we have as UNODC. But in your parliaments, in your parliamentary settings, in your work in different countries where you are, you can also do the same in terms of your own national legislation to kind of orient. But beyond just being part of, so basically, don't wait to be invited. Knock on that door and go yourself, because you can lobby, you can mobilize yourself not only as one youth but as a group of youth to come forward. Beyond this, we are also arming the youth themselves with tools to actually do prevention. So it's not only being implicated in the policy, but actually being in action and helping your fellow youth on one side to kind of echo your voice on the policymaker and actually do prevention and actually build that resilience. There are certain tools that can help you. That's an initial thought in terms of being action, but the main call is don't wait to be invited. Make sure you are on that table when things being discussed, because these are, determine your role in terms of how to move forward.
Thank you so much. That's very incredible. Maybe if you can share a link to that guideline that you were talking about, and then we can pass that along as well. I think that would be very helpful. Anyone else who would like to add to this question?
Maybe me?
Yeah.
Yeah, when we mobilize youth, or when youth mobilizes itself, I think we should take this into account, that if we leave them alone without guidance, without giving them some skills and knowledge about evidence-based prevention, they would keep doing the same mistakes as we did in the past. So I think one of the crucial points here in this process of engaging young people is to guide them to the right direction, to introduce them the international prevention standards, to introduce them prevention science, and telling them, educate them what works, what doesn't work. So they start from the point zero, not from the negative point as we did in the past. So I think this is the crucial message I want to share here with you.
Thank you so much. That is indeed very important. Yeah, Darshan.
Just to add to what they was telling you, that I represent SOVI with the Fourth Way Foundation. What has become helped the SOVI youth a lot is all those interactions we had with the prevention experts. So it was not just us working blindly based on the knowledge we have, but a lot of insights from different parts of the world, different experts, which made it possible for these youth to then go back into their campuses and communities and do prevention, which actually works. And the organization approach of also prevention first and youth first and children first and Forte Foundation has paved way for a lot of young people to do what Forte Foundation includes to do. So it's a whole bunch of youngsters who do prevention work in the grassroots, which has made a huge difference of us working with you.
So a very quick one. Can I come in?
Of course. And then Susan, after that you can add.
All
Yes,
right. I
please,
think
Ali.
to add to what Mate and Wadi said, especially with guiding the young people to do the right thing based on evidence so that we don't repeat the mistake. And I think that will go in line with building the capacities of the relevant knowledge and resources they need, to carry out effective prevention interventions. Apart from that, a very key important missing link is empowering them with the resources to carry out this intervention. Because time and again, we've seen situations where young people being trained with, of course, the knowledge and the resources to carry out interventions, but to the barest minimum, they don't have the resources to carry out this intervention. So it will be like they have the information, they have the knowledge, they have the training, they have the capacity, but they cannot do anything with that. Of course, there are other young people who can go out of their way to, do one or two things, but to what extent can they continue to carry out this intervention? And I think this is critical for us, and that is why we advocate for, especially at a local level, the youth should have a platform where they get resources to carry out intervention at a national level and at a regional level, and then come to the global level. Thank you.
Thanks so much, Susan.
Yes, yeah, just to add, for me, I see reaching the youth where they can be found. So, and one of the best ways is, they tend also to be in groups, whether it is in formal or informal settings, because all of them will always want to reach out. So wherever they can be found, that is also the best place to reach them. And most importantly, to listen fast, so that what are their perspectives, so that then it can be incorporated into programming. And one of the things that I've always tried to do the extra mile is when we develop the strategic plan, because coming from the national focal point, when we develop the strategic plan, I'll say, what is it that we need to include? And therefore, getting the voices of the youth and even the children, so that you are able to, factor in. But one thing that I've also noted is we are talking of a population that is also very fluid. So today you will reach them, you build capacity, and then tomorrow they have already lost the interest. So they're in something else. So that is also another thing that comes about. Yeah, thank you.
Thank you so much for those great answers and input. And it's definitely true. I think both points, guidance is so important, and that's we can do a lot in that. But like Ali also said, oftentimes the resources for them to then continue onwards with sharing that message is often a challenge. And also what you said, Susan, with the fluidity that we have also noticed that whenever we work with youth, it's very great in the beginning, and at some point, of course, there's other things that come into life that might, make priorities a bit different in their personal life. So definitely something we will continue working with, and also with youth as well. So maybe that's also a question into Sowai. I know you have been working with this a long time. So how do you keep youth re-engaged on a continuous basis? What have you been doing in that sense?
Yes, for us, it has been a whole transition which the young people with us have gone through at many capacities. One, they've started, like you say, attending our webinars and programs, but eventually they become interns who work with the program on a programmatic level. And eventually, these are the people who are the face of Forte Foundation, the grassroots work we do. And when they are actively engaged in going back and working in the grassroots, then it becomes a long-term engagement for us with them and for them to continue what they were doing into their communities. So there has been a lot of life change for the young people themselves who have worked with us, and their stories inspire more young people to join us and continue what is doing. So all of that has been a very evidence-based approach, and the young people who work with us also see that it is science which we do. It is it's not something which is brought out of thin air. There's a lot of evidence and science behind what we do, which has also ensured that the young people who start with us continue with us on a longer journey. But it's usually this life's changed and the experiences of being in the grassroots and the impact they see which is being created in the grassroots, which helps them to continue doing what they're doing within their communities and with SOVI and with Forte Foundation.
Thank you so much. It's wonderful that you have put that kind of structure in place to give that a long-term investment in that sense and get a high return on that too. I see a question there, Q&A. It is by Ive Christogenes. He's like, what is the reason behind poor or lack of funding for prevention work, despite the evidences that prevention remains the best approach in a global fight against substance use? I know it's a big question, and I think we often worry.
I mean, it could be one aspect of it is just like, investment. Usually policymakers like to invest when they see the problem and they would like to solve it, just to take credit for solving it. When you talk about prevention, you're kind of investing in a context where, like, you don't see the problem and you don't want it to arise, right? So and it sometimes is not as valued as treatment responses. So, but it is important in that context to also reflect on the person-centered approach in prevention, where the investment can be showcased not only in terms of preventing something that is done there, but in terms of addressing other problems that could be more short-term than actual drug use. What I said, like violence, improving scholastic achievement, in implication. And that's why this evaluation of that we're looking for on terms of other, what we call it, mediating variables, the variables that will be linked on the long term for substance use, is very important to reassure the policymaker that this investment is actually doing an immediate effect right now. That's one. There might be others, but this is one of the main issues that are impeding this investment. And by the way, this is if it is in the right prevention. Not anything is prevention.
Thank you, Wadi. I think another discussion question. Sorry, Darshan, you wanted to say something? Unmuted
I
yourself.
just wanted to highlight that for a country like India, as they said earlier in the presentation, the only possible approach is prevention, considering the population we have and considering the huge number of youth who is present in the country. The only sensible investment is to make it into prevention, because then you're investing in an entire generation, and you'll also have a whole generation of youth who will be contributing members of the society as we progress forward. And that is why, long-term prevention approach is what makes sense in a country like India with such a huge population.
Thank you. Then as a final discussion question, I would like all panelists again, more of like a vision you would have. Like, what would you like prevention to look like in 5 years, especially in terms of youth leadership, science integration, and collaboration? You can say anything since it's a vision that you might have. You can start with Mate.
Speaking about vision is a little bit difficult, but I think it's not only about youth and youth engagement. I think we all important stakeholders should come together, especially at the community level, and start strategizing prevention efforts. And also, I think it's very important that we start doing a little bit more on policy advocacy, especially public health advocacy, because we see some groups around the world are very, very powerful and loud, regarding legalization of particular drugs like cannabis, and also some other issues which are relevant also from prevention perspective. So I think we should also be aware of these processes and be active as professionals in the field of prevention to maybe bring some other broader perspective also to drug policy, to human rights, to sustainable development goals and so on, so that our voices are heard. And not only, as I said, young people, but all of us, all important stakeholders are equally responsible for future and making this vision for prevention.
Thank you so much. Susan.
Yeah, for me, I see, actually, when you asked the question, I started literally projecting what do I want to see. Since I do capacity building, I would really, really want to reach as many young people as possible so that they take the role. And we are already doing that, particularly with youth groups, so that we create what we call the community work groups, so that from there we also link them to what is it that already exists, even in terms of even resources, because again, sometimes resources are available, but they don't know that it is actually available and how they can actually get it. So that is one thing that we are doing to link them, and we hope that this is something that can be sustained, so that the more they know about this, the more they will also be able to stand up and speak for what actually is for them. Because considering that they make the bigger percentage of the population, I would really be very happy to see that they are actually at the front. That is one thing I look forward to. Thank you.
Thank you so much. That would be beautiful, yes. Aliu, you would like to share how you would see or have a prediction for yourself?
Well, my vision, what I want to see in by 2030, I mean that's 5 years, of course, is a youth-driven communities across the world, not only in my region. What I mean by that, young people across communities that are very intentional about how healthy their lives will be without using drugs, and we will have more investment in prevention, particularly to address early substance use users in our communities, because this is, of course, something that is very, very lacking. And most importantly, I want to see young people championing the prevention intervention calls across the globe, And of course, the policy briefs, the policy documents that we have should not just be document and policy briefs at decision tables. They should be actionable, decisions should be taken, actions should be seen vividly. I hope that if we'll be able to see this in the next 5 years, our society will be more healthier. Thank you.
Thank you so much. Very strong statement. Would you like to say something, Wadi or Darshan?
I think we'll finish with that for so why the statement has always been very simple and clear that we orient youngsters so they're able to choose a lifestyle which keeps them away from all health and mind altering substances. And for us, when we speak about that in a country like India, like I again said, it will be like 500,000 youth taking that stance. And if over the next 5 years, through the work and through peer influences, in a country like India, if all young people start saying that statement, which we call the survey statement, it then puts together 500,000 people actively choosing prevention and then being able to contribute better to their societies.
That is indeed a very, very good vision, and I think very feasible as well. Wadi.
From my side, we already started a 5-year plan that I described through CHAMPS, and I really hope we will generate enough results that kind of mobilize further countries to take action. I would wish in the next 5 years to be able to engage with you more, to share these results with you, and use the power of the civil society organization and the youth through your podium to kind of incite others to support children earlier in their ages of development and prevention measures. And I'm honored to join all of you on this panel. Wonderful presentations from all. Thank you also, Cressida, for the opportunity.
Thank you so much. So with that, it's perfectly timed, I would say. We are just a few minutes before the end of the webinar, and I would like to take this moment to thank you all of the speakers. Like Vadi said, it was incredible presentations. I think it was a lot of good and inspiring insights. Thank you so much for all the participants who joined us here today and have been very engaged in the chat and also in the Q&A. It has been great to hear where all of you have been joining us from. And I think as I said in the previous presentation or in the previous webinar, this conversation is not an end. It's not at the beginning either, since we have already had these conversations for many years, but it is a conversation to be held in the continuous years in order to continue working together with all stakeholders, as we do with regional and in national level and international level, and with civil society and with youth and the communities. All of us need to work together in order to create a very strong society, a resilient society in which we work with prevention, but also very comprehensive prevention. So thank you so much for joining this conversation and continuing it forward. We will be sharing the recordings and the minutes later this week, and also certificates for those that would like to. And let's keep this conversation going. I know that now the coming weeks, we also will be presenting the Youth Declaration once again that was published earlier this year to kind of continue the conversation of the youth. As Susan said earlier, it is important to listen to them, and the Youth Declaration did that. They listened to the youth. So do follow us on our social media and keep an eye on our social media and email for another webinar, hopefully in February or March, in which we once again will focus on the youth and the voices of youth and prevention. So for now, I would like to wish you a wonderful rest of the day and the week, and we will look forward to seeing you again soon. Thank you so much.